In 2006, a mother found her healthy 13-day-old baby unresponsive in his crib. His skin was bluish and he wasn't breathing. Authorities were called, but resuscitation efforts were unsuccessful. An autopsy revealed no immediate cause of death, but a toxicology report later revealed that high levels of morphine was found in the infant's blood. Morphine, a potent narcotic given for pain management, wasn't prescribed to this infant post-birth. So how exactly did this happen? Did the mom give her baby morphine? Yes, but unknowingly. Frozen breast milk at the home was also found to have high levels of morphine. And that same breast milk had been used to feed her baby. It turns out that the mom had been prescribed Tylenol 3, which is a mix of the drugs codeine and acetaminophen. This was to help with postpartum pain. When the body breaks down Tylenol 3, it takes the codeine and turns it into morphine molecules, which then go help to ease pain. But Tylenol 3 is commonly prescribed to new moms for postpartum pain, so what exactly happened in this case to cause such a tragedy? Well, the answer lies in genetics. Genes play a very active role in how the body responds to medications. The study of the interaction between genes and medications is called pharmacogenomics. Besides being a mouthful, this branch of pharmacology is paving the way for more efficient drug treatments and new developments in personalized medicine. We will be talking about the new developments and the science behind pharmacogenomics, the benefits of using it when prescribing medications, and a few challenges within the field. The reason why everyone responds differently to medications is due to a variety of factors, things such as age, gender, and overall health. But small differences within specific genes can also affect how the body reacts to medications. For example, the gene CYP2D6 makes a protein that breaks down medications into different molecules, as seen with how codeine gets broken down into morphine molecules. Some people have a variant within this gene that causes it to not be very active, so the codeine doesn't get broken down as well or as quickly, and it's not as efficient as relieving pain. People with this genetic variant are called poor metabolizers. However, some people have the opposite issue. They have a genetic variation that causes them to be too good at breaking down the codeine. They break it down too quickly and it causes high levels of morphine to build up in the body. These people are known as rapid or ultra-rapid metabolizers. The new mom who took Tylenol 3, which contains codeine, was a rapid metabolizer, unbeknownst to her or her doctors. This caused her body to create morphine very quickly, and in turn, the morphine built up in her breast milk. Pharmacogenomics seeks to understand if someone is a poor, normal, or fast metabolizer. This information could be crucial for optimized drug treatment, especially as it relates to critical conditions. The application of pharmacogenomics to drug therapy could save time, money, and lives. Drug treatment plans often come with lots of trial and error. It involves finding out what drugs work for patients, which drugs don't, and at what doses to give them or not to give them at. This can take lots of time and money, things that many patients can't afford. With pharmacogenomics, doctors will be able to understand which medications work best for their patients and which ones could cause adverse side effects. Adverse side effects are undesirable or harmful effects related to medication usage and can even be life-threatening. According to a study published in the European Journal of Clinical Pharmacology, it is estimated that between 5 to 10% of hospital admissions are related to adverse side effects. Another study published at the peer-reviewed journal Annals of Pharmacotherapy found that over half of these hospital admissions are preventable. Pharmacogenomics could be a viable way to mitigate these adverse drug effects by predicting how the body will respond to the drug before it is even administered. Additionally, this branch of pharmacology could lead the way to the development of new medications, ones that would be specifically designed to treat people who are these slow or fast metabolizers. This would further personalize drug therapies and treatments. Overall, getting patients the care they need in a timely and cost-effective manner are some of the many advantages of the application of pharmacogenomics. While there are several benefits to pharmacogenomics, there are a few challenges that should be discussed. For example, despite being a possible solution to time-consuming drug trials, scientists have limited knowledge on what exact genes are associated with drug metabolism. Therefore, it could take a long time for researchers to fully identify them, since there are an abundance of genetic variances that are related to medication breakdown. Furthermore, issues regarding drug alternatives could arise. Some conditions have very few approved drug treatments available, so if a patient is found not to be a good candidate for these treatments, they might be left with no options. And while pharmacogenomics could lead the way for the creation of new drugs, it may not be exactly profitable for drug companies to manufacture these drugs, since it would only be serving a very small percentage of people. Despite these challenges, the field of pharmacogenomics is promising. It allows for the study of how every person's unique genetic variances affect their body's reaction to medication. This way, healthcare specialists would be able to understand if their patient is a slow, fast, normal metabolizer, and prescribe medications accordingly. This has the ability to hasten drug therapy trials, prevent adverse effects, and lead the way for new drugs. However, there are a few complications to consider, such as the elaborate and slow process of identifying drug metabolizing genes, limited drug alternatives for people who are slow or rapid metabolizers, and the possible unwillingness of drug companies to invest in personalized medications. Overall, pharmacogenomics should not be ignored when considering the future of pharmacology. The field as a whole could have a major impact on pharmaceuticals and personalized medicine.